that they're suggesting in this May revise. It's a small penny, but it's a huge. When they're in crisis, they turn to their community. And with these cuts, the community would be gone. The BHSA was intended for organizations like NAMI and those standing behind us to be implementers of the behavioral health system and help Californians navigate within their communities. Today, a signed letter is being distributed in the assembly with many signers, and the momentum is strong. The assembly is calling for the leadership to reverse these cuts. The Senate has already had our back, and in their proposal, they saw that those cuts needed to be reversed. So we're asking the leadership to stand up. NAMI has stood by this administration and the leadership through Care Court and through Prop 1, and we're asking them to have our backs in this. The voters intended for these funds to be spent on behavioral health, not general contractor apprenticeships, CDCR trainings. They were meant to be for families and individuals within communities. And we're asking for those funds to be restored. These are not just nice to haves for us. This is our lifeline. This is the community safety net that is being cut. They're cutting us off at our knees if these cuts are not reversed. And I'm happy to have people here today. It's not just NAMI, it's the legislature, but it's also people here today within our community. And I'm honored now to introduce Brenda Graylish, who's the Executive Director of the Commission for Behavioral Health, here with us today.
Good morning. I'm Brenda Graylish, the Executive Director for the Commission for Behavioral Health. Thank you so much to NAMI California for hosting today's event and for your leadership in elevating voices of families across our state who are working every day to improve behavioral health care. Thank you as well to all of our advocacy partners, community leaders, and stakeholders for standing with us today. We are here because community voice is on the line. As Director Cruz mentioned, the May revise would eliminate the $6.7 million community advocacy program, the only dedicated statewide investment for helping people and communities engage meaningfully in California's behavioral health system. And this program is not large in terms of the budget, but it's enormous in terms of the impact. In fact, this cut represents less than 2% of the resources available to the state from the Behavioral Health Services Act. So this is not about whether the state can afford community advocacy. It's about whether the state chooses to value it. In fact, if anything, California should be investing more in community advocacy, not less. If we truly believe in democracy, equity, and uplifting underserved communities, then we have to make sure those communities have real voice in the systems that serve them. And the Behavioral Health Services Act was built on the idea that behavioral health policy should not be made without the people that serves them. Its promise was transparency, accountability, partnership, and meaningful participation from consumers, families, and underserved communities. Put simply, it's nothing about us without us. Proposition 1 did not move away from that principle. If anything, it made the need for community partnership even greater. As California asks communities to engage in more planning, more coordination, and more accountability, it makes no sense to eliminate the very infrastructure that allows that participation to happen. This is what this program funds. It funds trusted community-based organizations that provide advocacy, outreach, education, and engagement for populations that too often face the greatest barriers to care. That includes families, clients and consumers, parents, LGBTQIA+ communities, veterans, transition-age youth, K through 12 youth, immigrants and refugees, and diverse racial and ethnic communities. Our partners help people understand their rights, navigate complex systems, reduce stigma, and bring real life experience into decisions about access, quality, and service delivery. They help make participation real, not symbolic. If this program disappears, that capacity disappears with it. Eliminating advocacy sends the wrong message to the very people this system is supposed to serve. It tells people who are living with serious mental illnesses and or substance use challenges and the families who support them that their voices are optional. And for many communities, it feels like being silenced at the very moment they're being told the system is supposed to work for them. That's not partnership, that's exclusion. People cannot benefit from services that they don't trust, do not understand, do not know how to access, and do not believe were designed with them in mind. Community advocacy is what closes that gap. It builds trust, it creates accountability, and it helps ensure that public dollars are spent on systems that people will actually use. So eliminating this funding would not just remove a budget item, it would silence those trusted messengers. It would disrupt the work that's currently underway. It would weaken all that community engagement infrastructure at the very time that the state wants to strengthen it. So today we're asking state leaders to reject the proposal to eliminate the $6.7 million community advocacy program. I was there when the Mental Health Services Act was first being developed, and I can say from personal experience that the authors never intended for the state to go backward by cutting out the voices of consumers, family members, and underserved communities. So let's fight this together to keep California from making a decision it will regret and that our communities will pay the price for. Thank you.
And now we have Michael Blecker, who is the president of the California Association of Veteran Services Agencies.
Okay, thank you very much. So my name is Michael Blecker. I served in Vietnam as a combat veteran, and I'm currently executive director emeritus of SOARS. I was CEO for many years, and I'm also serving as a board president of the California Association of Veteran Service Agencies. I joined SOARS nearly 50 years ago, and I've spent most of my adult life working alongside vets struggling with trauma, homelessness, addiction, poverty, and the long-term consequences of military service. It was my generation that witnessed firsthand what happens when systems are not built to serve veterans. We saw friends and fellow vets returning home carrying the invisible wounds of war, only to find closed doors, fragmented services, and a VA system that was often inaccessible to the very people who needed it most. What we learned there remains true today. Engagement must start in the community. Big thing for us right here, trust and community. That's terms come up all the time. That's our bread and butter. That's our blood that feeds us. Veterans seek help from people they trust. They seek out places where they feel understood, where they find camaraderie, dignity, and a sense of belonging. In fact, the vet center that exists across the country today was inspired in part by community-based efforts like Swords to Plowshares, because it became impossible to deny that vets engage differently when services are rooted in trust. That's exactly why the California Association of Veteran Service Agencies was created. Our statewide network was funded to ensure vets are not left out of planning, policy discussions, and resource allocation decisions. We exist to bring the realities we see every day in our communities directly to policymakers and system leaders. And that's why we're here today. As the last speaker said, the proposed elimination of the Commission for Behavioral Health's Community Advocacy Program would remove one of the few statewide mechanisms designed to ensure that vets and other underserved communities have a voice in shaping California's behavioral health system. This program is not simply about advocacy, it's about making sure public policy is informed by the people actually delivering care and the people actually receiving it. It's about ensuring that decisions that are grounded in lived experience rather than assumptions. and it's about creating accountability when systems fail to reach the people they are intended to serve. Vets remain one of the most underserved populations within California's behavioral health system, despite experiencing disproportionately high rates of trauma exposure, suicide risk, homelessness, and behavioral health challenges. Yet vet mental health remains chronically underfunded in California. We hear a lot about vets when new initiatives are announced, but the reality is that dedicated statewide funding for vets remains markedly scarce. The state's primary veteran-focused mental health funding stream provides us $1.27 million annually statewide. And while Prop 1 included funding for vet housing, it largely pays for buildings, not behavioral health services. Vets are too often celebrated and policy discussions are forgotten when the resources are allocated. At the same time, behavioral health systems continue to operate within the assumption that the VA meets vets' mental health needs. The VA is an essential partner, and we deeply value that partnership. But state and local governments cannot sidestep their responsibility to vets by assuming the VA will take care of everything. Less than half of Vietnam veterans use VA healthcare. Many vets rely on community systems because of stigma, distrust, their discharge status, geographical barriers, or eligibility restrictions. Meanwhile, those vets serving organizations consistently identify behavioral health and substance abuse challenges as among the leading causes of housing instability, crisis evictions, and disengagement from care. The need is growing while capacity is shrinking. The VA's Office of Inspector General recently identified more than 4,400 severe staffing shortages nationwide, a 50% increase from the previous year, and the highest number ever recorded. Nearly 60% of VA facilities reported severe shortages of psychologists. That makes community-based engagement and advocacy more important than ever. The Kellum Community Advocacy Program organizations across California help identify emerging needs, educate providers, strengthen local systems, elevate community voices, and ensure vets are included in behavioral health planning and funding decisions. At SWORDS, one example is Combat to Community, our military and veteran cultural competency training program. Most individuals, if they don't have an immediate family member, know very little about what it means to serve in the military in our country. In our recent wars, just the issue of driving in places like in Iraq and Afghanistan, roadside bombings, the IEDs. More than 15,000 professionals have completed this training, helping behavioral health advocates, first responders, educators, and community organizers better understand vets. This is exactly the type of work the Community Action Advocacy Program makes possible, ensuring policies and programs are informed by organizations rooted in communities and trusted by the people they serve. After nearly 5 decades doing the work, I can tell you that the best ideas rarely start in government. They start in communities. They start with listening, they start with trust, and the Community Advocacy Program ensures those voices are heard. We urge the legislature and administration to reject these cuts and preserve this critical investment so vets and other underserved communities continue to have a meaningful seat at the table. Thank you.
Thank you, Michael. And now we're going to hear from Dr. Yami Rodriguez, the Chief Government Relations Officer of the Youth Leadership Institute.
Thank you so much for having us today. I'm standing here today on behalf of our young people all across the state. I represent the K through 12 advocacy contract that works directly with young people to lift up their voices at the local level to create change when it comes to mental health access, to resources, and to represent their families and the most vulnerable. I represent 8 regions in the state of California: the Los Angeles area, Ventura, Merced, Eastern Coachella Valley, San Mateo, San Francisco, Marin, Sacramento, and Humboldt. We represent communities that are the most vulnerable. those that don't have voices, those that are silenced. We represent the immigrant communities, the Native communities. One of our organizations who is in partner with us, Pro Youth Family Sacramento, is with us here too. And we also have our organization that is in San Francisco. That is how important this is to us. This cut would silence and rob the voices of our youth when it comes to change in their communities. The work that we're doing in advocacy is to create long-lasting generational change in their neighborhoods, in their cities, and on a statewide level. We cannot have this cut. It would be detrimental. Not too long ago, since February, we've had meetings with our California state legislature. 60 young people with their adult allies have met with about almost 70 of the assembly members and the senators, telling them how important this program is, letting them know that when we see young people as the true leaders and resources that they are, change happens. This investment has to happen, not a disinvestment. It will prove detrimental to our state and to our youth. I want to make sure that you hear from one of our young people's voices. And this is from Amadeus Castillo. He said, "This program is so important to me because it gives me and my friends a voice to talk about what we care and advocate to be a part of something bigger than myself that will affect youth all over California. We are the future voice and future leaders of California." Elia from Humboldt County, who is from our Native community, says, "This program is so important to me because I get to have exposure to community concerns, complications, and challenges. I get to be that youth advocate for solutions. Help me, California State Legislature, please reject these cuts because you will silence the voices of Amadeus and you will silence the voices of Ella. Please do not do that. And we ask you to reject the cuts."
Thank you. And thank you all for being here. Bottom line is we need to protect Prop 1 funds. We cannot let Prop 1 become the piggy bank for the general funds that they need to backfill. Thank you all for being here today. And if you have any questions, we're happy to answer them. No? Good. Thank you.